Just a second. Meghna and Akansha, send the Zoom link to our groups also, because we not everybody who registers joins. So you can just send the Zoom link to all our groups again. We generally do that at the last minute anyways, and put the Zoom link on the other channels as well. Great. So yes, Rahul, I think we can start, and we'll be live streaming this on YouTube. So at some point that live streaming is also going to start.
Yeah, it has started.
Oh, has it? Okay.
Yes.
All right. Yes. Yeah, go ahead, Rahul.
Okay, so namaste, all of you. It is a privilege to welcome you all on behalf of Swasti Vishwa Behavioral and Social Sciences Institute for the panel discussion today. As you all know, we celebrate October 10th as the World Mental Health Day. And this year, we are celebrating it tomorrow. And on the eve of World Mental Health Day, we have organized a panel discussion today. The theme for this year World Mental Health Day is making mental health and well-being for all a global priority. So it's a huge kind of ask which we have given ourselves, that we want to make it everyone's business to have mental health and well-being, and it is for everyone. So it's such a nice welcome change to see the transition from mental illnesses and mental disorders, although they are extremely important, to including health and well-being as part of our sort of dream statements or vision statements. So this year we want mental health and well-being. So health and well-being includes not just mere absence of diseases, but a very kind of, I mean, again, it encompasses a vision of one health. So not just individual health, but health of humans, health of animals, health of environment, and the aspiration is to have a healthy planet, or a healthy healthy, our beings should be at the end very healthy. And with that particular aspiration and with that particular goal at Swasti Vishwa Institute, we thought that it will be good for us to organize a panel discussion on holistic mental health. Although holistic and health are very similar, so it's a repetition of words, but it is still, I think it's more for emphasis that we want to have a discussion on holistic mental health with a specific focus on the levels of intervention. So today our discussion will be more on various perspectives on multi-level interventions. And in that, our speakers will be talking about the levels of interventions which they feel are of utmost importance. Uh, Before we begin, I'll very quickly kind of set some housekeeping rules. So what we will do is we have all the speakers in the spotlight mode, so you will all see them throughout the presentation. Um, we will have three presentations from three distinguished panelists today, whom I'll introduce in a while. And I would request all of you to keep your mics on mute mode. If you have anything to say, please raise your hand, or enter your comment in the chat box. Meghna and Akanksha are here to kind of look at the chat box. I'll also be trying to do that. And I would request you to kind of keep typing keep inputting your questions and comments as the presentations move on, because we won't have time to interrupt the presentations and take the questions and comments in the middle. But once we are done with our 1 hour of formal presentations and formal discussion, we will dedicate around 30 minutes of time to do that. So don't wait for that particular time, because by that time you may not. By that time, some of you may be in a state of complete satisfaction and no queries, no comments, and in that case, we will miss some of the rich discussions, which is the cornerstone of some of these panel discussions. So start typing in your comments, and we will kind of collate them. I'll first request Dr. Swati Karve to speak a few words about the institute itself, and she will kind of give a background. And then I'll introduce speakers one by one, followed by their presentations. At the very outset, I would just like to say that we are very fortunate to have to have a very distinguished panel today, and all of them. I mean, it's such a, nice thing to have all of them as founders of some or the other organization. So, except me, all four of them are founders of their respective organizations, and we would like to know about their work as we move on. So, before without spending too much of time in the introductory remarks, I would now invite Dr. Swati Karve to say a few words about Swasti Vishwa, and then I'll introduce the first speaker, followed by her presentation, then the second speaker, followed by his presentation, and finally the third speaker, followed by her presentation. So over to you, Swati.
Hi, Dr. Rahul. Thank you so much for starting this off, kicking this off really, really well and setting the tone and the setting the expectations. I'm Dr. Swati Karve, founder, director of Swasti Vishwa Behavioral and Social Sciences Institute Foundation. We are a Section 8 company, non-profit company. And our goal is to bring education, training, and services, making them affordable and available. And one of our emphasis is on mental health. So we provide mental health education to the community, to the mental health professionals, and anybody who is related to mental health field in any way. So we provide education, training. We have international and national collaborations and associations through which we bring this education. And we also emphasize on these informal educational events like panel discussions. And this is probably our third or fourth panel discussion that we have had since we started. So I'm extremely happy and honored and proud that we have an amazing panel here today. And we have been hosting such webinars and programs. And I'm so happy to see that so many participants have registered. I request Akanksha and Meghna to enter our website in the chat box and also our social media handles, because I do not want to introduce too much about us and take away the valuable time that is allotted to us today. So with that brief introduction, I request Rahul to take it forward. Thank you so much. Really honored. Thank you.
Thank you, Swati. And I must say that Swasti Vishwa is focusing again at multiple levels. So they are focusing on individual level delivery of psychological interventions, which is such an important need, because even today as a psychiatrist, whenever I have to refer a patient to a psychologist or a trained a counselor, it is extremely difficult even in the cities. And many of you must have experienced that. So the institute is focusing at the individual level service delivery. They're looking at ways in which they can work with various organizations, both non-profit and profit corporate organizations, to improve the performance of human resources and how to kind of build capacity. And finally, they are also working with communities, people in cities. So they're working at multiple levels, and probably that's the reason why the panel discussion today focuses on multi-level intervention. So it can never be focusing only on one aspect of service delivery. And with that particular background, I think I would like to thank Swasti Vishwa for organizing this panel discussion. So we will now move to the first speaker of today's panel discussion, and she is Mona Sharma. Mona is she's a psychologist, and she's trained at Beck Institute. So she has received her training of cognitive behavior therapy from the place where it actually originated. And she has been extremely lucky to also interact with Aaron Beck and the team. And along with Swati, she conducts multiple capacity building courses and to deliver cognitive behavior therapy in India. I think cognitive behavior therapy training in India is at a very, very preliminary level, and Mona, along with Swati, is contributing to that huge effort. Along with that, Mona is also a trained public health professional, and she has received a training from an institute which considers itself as the best in the universe. Universe because it's best in the US. So for them, US is not enough. So universe is the level. Johns Hopkins Institute, Johns Hopkins School of Public Health. So she was trained in Johns Hopkins School of Public Health. So she has a very unique blend of training at the individual level service delivery in the form of psychotherapy, cognitive behavior therapy from the Beck Institute, and how to deliver those services at scale from Johns Hopkins School of Public Health. She has also worked with multiple organizations across the globe, including the World Health Organization, All India Institute of Medical Sciences, Public Health Foundation of India, and has been instrumental in many studies which have far-reaching impact. I think one of them is the International Classification of Disease Studies, where ICD-11 classification. She was a part of that. So maybe with that brief introduction, I would now request Mona to speak about her work, and most important, she is founder of the Manorathy Foundation, which is based out of Delhi, and she works very closely with people living with mental illness, which I think for clinicians like us is a very important kind of a thing to know that it's important to work very closely with people with mental illness, and she kind of fulfills that gap. So she is not an armchair academic. She's actively involved in people, and we will now know about her work. So before I hand it over to you, Mona, I would request you to do a formal kind of a presentation. I know there are no slides, but I would request you to kind of spend next 15 minutes. And in the interest of time, I would just remind you when the 15-minute slot is almost completing. So over to you, Mona, and thank you so much for accepting our invitation for today's panel discussion.
Thank you so much, Rahul, for such a elaborate introduction. I should have recorded it and use it in the future whenever I'm introducing myself. but thank you, Rahul. So Rahul has known me for more than 10 years. We were classmates at Johns Hopkins School of Public Health, and then we worked together. We have remained friends for the past, I think, 12 years, more than 12, 13 or 14 years actually. As Rahul mentioned, my current role is the founder and director of Manorathy Foundation. Manorathy Foundation is a service user organization. So it was started by people who had a lived experience or direct experience of either living with or caring for people with mental health conditions. For example, I had both lived experience as well as a family member. I am in my family, there are 2 people living with major psychiatric disorders. Over the course of my profession, I met more people like me who were working in different in health sector, but also were struggling with mental health conditions at a personal level. And we could feel the gap. We knew there is a gap. So whatever I was learning or doing, be at WHO or at AIMS, versus my role as a daughter-in-law, or as a person myself, I did not see those learnings or my professional work translating to help me at a personal level, to the extent that it started impacting me. So about 2 years back, I decided to leave the work, my profession as a public mental health professional or as a CBT therapist, and to start this organization, Manorathy Foundation. So when we started, just soon after that, the COVID pandemic hit the globe. So when we started, the idea was to expand the lens on mental health care. So mental health care is not only about treatment or interventions. So if I have mental illness, if I have depression or schizophrenia, I just don't need only therapy and medication. That is just tip of the iceberg. If I look at the needs as just touching the tip of the iceberg, what about my other needs? What about my needs to have social relationship, to be employed, to be understood at my job, to be acknowledged that I am living with a mental health condition, with a disability, and along with how do I what about my marriage, about my relationship with my children. So this is what I thought, these needs as a person living with mental health condition or as a family member, these needs are being overlooked, to the extent that even at one point even I believed that only intervention, only care I needed was treatment. And I remember that, when my mother had a relapse, first thought that came to my mind was that, have you stopped medicine? I didn't care to look at, what is happening in her psychological, in her social environment. Is there any loss that she's suffering? Is there something else that's happening, beyond treatment? So I think number of these instances got me to, leave my job and start this non-profit organization. There we I started, when I started, I wanted to understand what I believed were important, the needs that were important, how to fulfill. So I was very new, when I would go to my colleagues, I remember at James and saying, these needs are important. I was told by my seniors who were psychiatrists, trained psychiatrists, that, okay, fine, they're important. So what are you going to do about it? Why don't you do anything about it? Do you have any solution? Okay, fine, we understand social needs are important. What is the solution? If you have a solution, why don't you implement? So that is what I think final push was there, that, okay, I want to see, okay, I'm complaining. I'm going to psychiatrist. I was going to once or twice with Nirmala ji also. I was engaged with Nirmala ji's group also in advocacy, where I heard even, policymakers saying such things. Okay, fine, you tell us the solutions. If the solutions are so easy, why don't you go and implement? So that part I was like, let's not complain. Let me see actually whether solutions that I'm thinking, are they possible or not? Needs are there, but what are the solutions? What are the interventions? So what if, the professionals or policymakers are not talking about it? As a person who's receiving it, who's, living with it, let me see, what solutions I think are possible and whether they're implementable or not. So anyway, so we started Manarathi Foundation during that pandemic hit time, and we decided that, though we started to work with people, idea was to start to work with people with psychiatric disorders, because that is what formed the group that started Manarathi. But we expanded. We decided to expand it to across age groups, across disorders, not only psychiatric disorders, but even people experiencing mental health issues or need for mental health care. So we evolved to, also look at different aspects of treatment. So, treatment, not only medicine. So treatment is important, but what are the other, for which I think Rahul and Swati also helped me to, broaden my perspective, that, there are other forms of treatment that, one can look at, be it psychotherapy, yoga, or other natural ways of caring. So these are, as we went along, we were working with individuals. We were not working in groups. So we decided these interventions slowly, we built in our work. And as we went along, whenever we saw that certain interventions worked with, some groups didn't work with some groups. So we just, kept learning. And one need that I felt very strongly was capacity building. And now that has become the core work of our organization, which is capacity building of families, of individuals. Currently, like we are, and two of my students are here today. They are university students. Capacity. These are the students who, for last 2 years, I had university students coming to me and saying, uh, everyone in my college, in my class is, upset or anxious or depressed. So when I asked, what are the needs are common. So these students coming, we thought, why not to start these capacity building programs for people who are coming to me with needs. So if a student is coming to me with need, to deal with anxiety, I was asking him, what is happening around you? Are there other people who are anxious? Are there other people who are experiencing the same issues? So that led us to, start to develop. So I'm trained in psychological first aid at Johns Hopkins. That is where this program was developed. So I tried to, change psychological first aid and combine it with CBT. So I think CBT is a very flexible technique. So combine CBT and psychological first aid. And we developed different modules for people with psychiatric disorders, with common mental health conditions, for professionals, for doctors. We also earlier this year for doctors who were providing care during COVID times. Now and last year for students. So we developed these modules, and we started training people to take care of themselves as well as to take care of those around them. So not only for self-care. So we developed these training programs are called self-care and psychological first aid. So people can get trained in both, or they can decide to get trained in only self-care. And then we kept supervising these programs. So those who also wanted to be trained to care for others. we also started supervision, monthly supervisions for them, so that they feel supported. So basically, this is what our journey has been so far. So what we started with, to say that, okay, we will look at needs beyond treatment or psych people with living with mental health condition. That remains, that one of the goals is remains there. So we also are, for example, we have groups that where we peer support groups. We have employment. We actively engage people to find employment or livelihood organizations. We have associated with different institutes where training or work can be provided. And one program which I think just came up and has been unique was also helping people to form relationships, to get into marriage alliances, which was not really done consciously, but as we went along, this need kept coming so strongly that we decided to focus attention here. Uh, so that one program is going on alongside another program, like I said, which we thought during, in the last 2 years, it's important for us to focus on. And given my capacity, given my experience, I thought I should develop this program, which was a mental health or psychological first aid and self-care. And that module now we have expanded, and we have developed different modules for different groups. And this week, the students that are working with me, they are starting. 4 students are starting self-help peer support groups in their colleges. So this so yes, so this was about Manarati Foundation and our journey, Rahul. I would like to end here and answer more questions as we go along.
So thank you, Mona, and first of all, thank you so much for sort of explaining your work in nutshell. I know it's a very long journey, and although it sounds like 2 years and 3 years, but then it takes lot many more than that number of years to get into the kind of work which you are doing. I would just request you to kind of provide any links or details in the chat box as other speakers are speaking. And then I have specific questions for you, but I'll reserve it for the next round once we have a set of presentations from other two speakers. So thank you so much for highlighting some of the very important aspects. And let's hold on for now. Let's move on to the next speaker, and then we will revisit what you had to say. So Swati, you have raised your hand. Do you want to make any comment?
No, not really a comment, but just we'll be just taking down some points as they are speaking and putting them in chat, like some of the important things which are there, and capturing it in the chat for all the audience. So me, Akanksha, and Meghna would probably be doing it. There may be some repetitions, but thought we'll just capture it before we all forget. Okay, so keep looking at the chat. Thanks. Go ahead.
Thank you so much. So let's now move on to our next speaker, Dr. Anil Vartak. Dr. Anil Vartak was working in Sir Parshuram Bhau College in Pune. It is one of the most reputed colleges in Pune, and he worked there for decades, and also received his PhD in economics from that particular institute. So he's at the very core, he is an academic, but he is also someone who has extensively written about mental illnesses for common people in so many newspapers, in some of the leading Marathi newspapers, Sakar and Lok Satta and other places. So in fact, as someone interested in psychology and psychiatry, I have grown up reading his articles in Sakar, and it was very inspirational to know about, I mean, the way he used to put some of those things. And he has also developed a number of modules and a number of manuals to explain mental illness to people who wish to know more about it. And it's not just people who suffer with mental illness or their families, but there are many others who would like to know about what exactly mental illness means, because there are a lot of, even in educated populations, there are a lot of misconceptions about what is and what is not a mental illness. So he has done phenomenal work in spreading awareness about mental illness. He was associated with Schizophrenia Awareness Association earlier, and he has now moved on to again establish a new organization. He is founder of Ekalavya Mental Health Foundation, about which he is going to speak about to us. He is also involved with other organizations in the field of global mental health, such as Sangat. He has been on the advisory board of Movement for Global Mental Health, which is a global collective to advocate for mental illnesses, focusing on the lived experiences of people with mental illness. And as Mona had pointed out, Anil ji was also instrumental in developing a course, a capacity building initiative for service users and their caregivers to better understand the new Mental Health Care Act and how to kind of utilize it for the overall benefit of people with mental illness. So maybe with that background, I would now request Anil ji to say a few words about his work uh, and enlighten us on those aspects. So over to you, Anil ji, and you have, I think we are good on time, so you can comfortably make your presentation over next 15 minutes or so.
Okay. Thank you, Rahul. And I started, means I came into this field much back in 1995. And before, around that time, I was struggling with my own mental health issues. And I joined a self-help group that was in existence in Pune. And that benefited me a lot. And it helped me to sort out the issues, the residual issues, and develop coping skills, develop socialization. And that prompted me that there is a great need of self-help group in Pune and everywhere. The group with which I was working earlier was a closed group, means they did not want publicity. And I realized that if there are large number of people around me who are in search for such a platform, why can't I provide it? Why can't I be instrumental in providing it? Maybe I may be required to disclose my identity or as a person with first-hand experience, but then the benefit I received convinced me that there is a great need. We all actually know that individuals, they receive professional treatment and then symptoms are controlled. And they live in the society, they live in the family, they may continue their work, education, and everything. But then there are several issues that are not adequately addressed. The formal treatment or professional treatment is not able to address several issues. And there may be lack of information, lack of space for sharing, lack of support, lack of coping skills that are required in day-to-day life, lack of socialization, and then rampant stigma that we experience everywhere. So I think that these issues, they are not addressed at all. And a support group is a place, is a platform where people can freely share. Nobody looks to them in a judgmental way or right or wrong way, and they are viewed as they are. And that is why people share freely. There is a ventilation, there is a support, there is coping skills and everything. So I think that it is a buffer between individual or family and the wider society, or what we can call as stepping stone. And with this conviction, I decided to start Ekalavya Self-Help Group way back in 1997. And in the initial periods, there were some problems, maybe getting space when people come to know that we are having this kind of group, or there was stigma, or even our own members, they were skeptical about how far it will be useful, because people were convinced that it is the professional treatment, that is the only treatment. And then there were professionals who also were not sure about how far the group will be helpful. But over time, we learned through our mistakes. And there were several mistakes, and then gradually we settled down in terms of pattern, in terms of method, in terms of venue, timing, in terms of skills of facilitators, and so on. Gradually, there was a transition from complaint group. It used to happen that patients and caregivers used to share their own problems. So from complaint group to recovery oriented group. So this happened gradually. And then gradually over time, we started receiving support from even professionals and other Shubhartis and Shubhankar. In this entire period, I very clearly remember that newspapers supported us in a great way, in a big way. Since beginning, Sakal, Maharashtra Times, and many newspapers, English, Marathi newspapers, they always supported and gave us a platform. So the point is, what we thought that, now what we think that WHO has given a pyramid of optimum utilization of resources. And the World Health Organization, they support that self-care and informal care is a very important source of providing mental health services, which is of low cost and which should be utilized frequently. Now, over the time, we develop our own pattern of conducting the meetings. And at present, we conduct the meetings in 3 different ways. One is recovery meetings exclusively for patients, or what we call as Shubharti, seekers of well-being. Another is for caregivers, Shubhankars. And another third one is combined meetings, where Shubharti, patients and caregivers both participate. So unlike Western countries, where separate meetings are necessarily conducted, their interests are many a times clashing also. But in our country, family is a basic source of providing support. So combined meetings are also very useful, and we have developed that pattern very useful. When we conduct meetings, when we conduct meetings, around 25 to 30 people are there. And what we observed that new members, they also receive good support from senior members. In fact, this is a very general trend that we see. So what we say that care receivers also become care providers over the time. And this is the basic philosophy of a self-help group, that veteran people, senior people who have received support, who have understood the importance, they later on start giving the support. Now, what we observe that we discuss, we have discussion on various issues in our meetings. Sometimes the topics that are discussed are spontaneous, means people share their some recent experience, and that becomes a topic of the discussion. But sometimes pre-planned topics are also come for a discussion, and on the whole, a variety of topics are discussed. Now, we think that this support group meetings is a very important source of intervention in the community. Rahul, should I continue or should I go in the next part? Yes. We think that support groups of caregivers and patients is an important source of intervention. This is they are not only useful in Pune because Pune have that kind of atmosphere or patients and caregivers, but in every large city, in every middle class city, the same situation is there. People from different parts of Maharashtra contact us, and they also join some of our online meetings. And the needs of the caregivers, needs of the patients are everywhere same. So what we think that the way we develop our pattern, the same structure could be replicated in different parts, at least at district places in Maharashtra. And we call it as a Ekalavya model. And people from different places, they need not learn through their own mistakes. So we are in the process of developing our own manuals, handouts, and some training material. And if we need any workshop to train them, then what may be the topics and how the workshop could be conducted. So all we are working on that. And what we think that this kind of model, it can be expanded and replicated at different places. What I think that when we take a review of community mental health initiatives in India, especially I have gone through such resources of Dr. Srinivas Murthy and several other people. And what I found that, what we have found that the initiatives have basically remained local. Means they haven't gone beyond a specific geographical place, and they depend upon infrastructure, physical and financial. What we think that this self-help group, basically conducted through patients and caregivers, is a low-cost kind of model. It requires some initial training, and then they can continue on their own. Apart from support group meetings, we also are working on some innovative programs. For example, recently we have we have made an appeal to send poems by patients and caregivers. We call it as a Bahar initiative, Bahar, Blossom. And we are receiving good support from patients as well as caregivers. What we think that there was a need of expression. People, patients and caregivers wanted to share their mental health experiences, maybe stigma, maybe struggle, maybe resilience, maybe hope, or whatever. And that they never got a space to share that. So with this kind of initiative, people are sharing their experiences, and that is going to become a very good document, a source of inspiration for the other patients and caregivers. And we are working in that direction. Apart from this innovative program, we are also collecting the stories of patients and caregivers, and there are a number of other innovative programs also. So Ekalavya model consists of support groups as a main source of intervention, and then innovative programs which will be basically supervised which will be basically supervised by persons other than patients and caregivers, because we cannot give many responsibilities to patients and caregivers. So this is the basic idea of our Ekalavya model, and we are looking forward to many such support groups in different parts of Maharashtra in the near future. And thank you very much for Rahul and Swasti Shri for giving this opportunity. Thank you very much.
Thank you, Anilji. And it was really, as your presentation as well as Mona's presentation highlights the need for some of the things which remain blind spots when it comes to mental health services delivery. Because again, see, every time what happens that whenever a person is suffering from not just mental illness, but any illness for that matter, what we have, I mean, somehow general population as well as experts and everyone tends to think that there has to be a pill for this particular illness. And I mean, if we talk about diabetes, it's all about blood sugar levels and your drugs and insulin. So we reduce that person to his or her blood sugar levels and whether he or she is taking medications well on time. And every time, I mean, imagine a family member with diabetes, and every time you meet that person, the first thing you ask is, how is your sugar and have you taken your medications? And it can be extremely offending. This can be an extremely offending, not just for for any illness for that matter. And if when it comes to mental illness, it can be very, very, very disturbing for someone when you keep on asking, how are your symptoms now? Are you feeling okay? Are you still hearing voices? How is your mood now? Are you feeling okay? Are you depressed, or are you now feeling okay? So many a times the person tends to think that, Are Baba, I'm not a collection of bunch of symptoms and someone who has to maintain my record of taking drugs so that you can feel comfortable. I mean, again, why I need to be symptom free? Because people around me should be happy and they should have a hassle free life. So I think both of you have underlined the importance of seeing person as a person, seeing the needs.
Yes.
I mean, we can call it with very multiple names and fashionable felt needs and other needs and things. Ultimately, it is about treating person as a person, treating person with dignity. Something as simple as that. So thank you so much for highlighting those things. We will now move on to our next and the final speaker for today evening, Dr. Nirmala Srinivasan. Dr. Nirmala Srinivasan started her work when professionals like Mona and me were doing our schooling. We were in our fourth standard, fifth standard in our schools, where we are not even aware of many of these things. So she was the first one to start a self-help group for families called Amend way back in 1992. And since then, she has been very actively involved as an advocate for improving the lives of people with mental illness. In 2008, 9, 10, till 2013, 14, there was a huge movement in India to kind of enact a new mental health policy and new mental health care act. And she was member of all those initiatives and has actively contributed in ensuring that the rights of families and guardianship issues are relevantly addressed in those discussions. She has, for her work, she has been awarded the Ashoka Fellowship, and she is like all other panelists here. She has founded an organization called Families Alliance for Mental Illness, again, which has been doing phenomenal work in the field of mental illness, and there are many resources on their website which, as students of mental illness, we have mental health, we have visited multiple times and have made use of, and her focus is essentially on making these things, making families as change agents. So she's going to talk about her work. And in addition to that, she also had a brilliant career with the Indian Institute of Management, which again, I'm not too aware of because the details are not available otherwise, but I would like her to also shed light on what her personal journey has been. Although all these speakers I know are very reluctant to speak about their personal journeys, but I would request all of them to connect their lives with the work which they are doing, because the work cannot be separated from the person. I mean, the creation cannot be separated from the creator. And in that light, I would also request Nirmala ji to speak about how you as a person has contributed in the kind of work which you have done. So over to you, Nirmala ji. And again, because we are good on time, please feel comfortable to kind of express your thoughts. And thank you so much for accepting our invitation. Over to you.
Thank you, Dr. Rahul, and thanks to Dr. Swati and her team at Swasth Vishwas Foundation for this splendid opportunity. Probably I'm the only odd person out in this panel who is not a mental health professional, probably. And as Dr. Rahul said, do throw life. I mean, he wanted us to start the journey from the personal front, but I want to admit whether it's good or bad, I don't know. It's for you all to judge. But I've lost my personal identity. My identity is on a common platform for all the stakeholders. I don't even call them persons suffering from mental illness, providing care, nothing of that sort. We are all comrades in the movement and we move forward. And that camaraderie and the spirit is very, very important. And tomorrow is probably the 18th or 19th World Mental Health Day that I am witnessing. And we are still talking about providing care for all, which is very important. Definitely, it's that's a very important mission ahead of us. And this mission cannot be achieved unless the families are involved in a perspective which is different to what it is being done. And that is the focus of my presentation now. And once again, thank you. And thanks for my co-panelists also for inspiring me to move ahead with this presentation. They have provided me a lot of inputs. Thank you so much. Now, I'll be happy to explain how this organization. I'm the founder of this Families Alliance on Mental Illness. And this is it's now come to popularly known as FaceMI or Face Me. Some people say Face Me, some people say FaceMI. I'm used to saying it Face Me. So Families Alliance Mental Illness Face Me, actually, the idea was there since 2013. The idea started with we had a 2-day workshop, residential workshop involving leading mental health NGOs, especially family caregiver NGOs across India. And from the outcome of the workshop was some of the members who participated in the workshop are very much there in the among the list of participants in this webinar. So the idea was that we do need a national network. That is very important. We need to speak one language. We need to talk. We need to openly share, and whatever the system can provide, the help that we need from the system, we need to unless we bring out all that, which will not be possible. And therefore it started, the whole idea started. And in 2015, September 12th, the Face Me was really born in a formal way. It was launched, and the launch was sponsored by the Ministry of Social Justice and Environment, Government of India. So from 2015, we have been going on. Here, before I say anything else, I have to underline the fact that probably Families Alliance on Mental Illness is probably the first and only family advocacy group in India. I wouldn't like to call it a family support group. Advocacy is also a family support group, but there is a difference. And to explain the difference, how do we make a difference in the landscape of mental health? How do we work using families as a change agent? It's very important to say that we don't work with families, like the way Dr. Bhattak, Anil and Mona were saying. They work with families, we don't work with families, but we work on family care. And it is a significant difference in policy, in programs, in action plans, in activities, in attitudes, in the way you think and behave vis-a-vis affected families and affected person. Shifting our thinking from families working with families to working on family care model, which is the cornerstone of Face Me's model. Face Me model is the family care model. And here it's also important to see that how do we use the word family? We use family in a very inclusive and unique sense. And I don't know whether it really appeals to all of you, because all through when I was working, and here comes in my personal bit of it, that from the 3rd day of my arrival in this world, my mother fell ill. I grew up in a household with a mother who had very strong, those days I'm talking about 1943. I'm very ancient in the field. I'm almost a vintage model due for retirement very soon. So this vintage model I'm talking is around the independence time, when there were no treatment for mental health except probably ECTs and Largactil. I remember the way my mother used to be cheated into electric shocks. She would be taken out for a drive and beach, Madras beaches, Marina Beach was very popular, and then go to the ECTs. I mean, I have been a witness to this, uncritical witness. I didn't understand as a child. I grew up in that. I didn't understand even as a child. I didn't understand even when I was married at 19 that it was an illness. I didn't understand. I didn't know. There was not, and awareness is not only about that it is an illness, but awareness is also how to manage the illness. Like yesterday I was telling Mona yesterday, informally, we had a chat, usually we chat occasionally. I was telling her how, if you permit a slight deviation, Dr. Rahul, I was telling her how my mother was never symptomatic when she was learning music or teaching me music, Carnatic classic. She was a great exponent of Carnatic classical, and no, I couldn't believe, looking back, at that time I was not aware. I was just enjoying myself singing with her, sometimes running away from the music class, bunking classes with my mother. She'll come running after me, tempt me with a lot of mithais to come and sit down and sing. It was very important qualification for marriage those days, learning Carnatic classical music and passing Madhyam certificate or something in Hindi, Madhyama certificate, something. I forget the name in Hindi. So these are the things, memories I have. But looking back, that was that in 40s. But now, how am I using the word family? I am not using family as an entity, as a part of this thing. No, I'm using families not as caregivers and users, not as those who provide care and those who receive care. Family is family. I live with my son. I live with my sons, rather. And I don't live as a caregiver, nor do they live as users. They don't, this is taken for granted. Sometimes we fight, sometimes we have fun, and sometimes we don't put quality care, sometimes we don't provide good care, sometimes we do overdo it. Professionals like we have plus one who don't like the word expressed emotions. I know they are very allergic to it. But for me, expressed emotion, it can be a wealth of emotions expressed. Wealth of emotions expressed. Though at that moment, at that fleeting moment, we may think it creates relapse, it provides. No, not necessarily. Not necessary. We have not understood the individual suffering or the family suffering. And we are going along, people are doing research using their own expertise. It's very important. But we use family in Families Alliance on Mental Illness, in Face Me. It is a fundamental doctrine that we use family in an inclusive sense, where caregivers and care providers or care receivers are not used, caregivers and PMIs, these are not used. We are family members and loved ones. We carry on. I'm not saying these words are not of any use. Definitely, these are of very important use. For example, for people, capacity building programs, Mona was talking about, or even for Government of India. I see a couple of people from NHSRC here. So even for Government of India to understand the budgetary allocations or whatever it is. All these words are important. Caregivers, who are the people who need mental health support system, who need psychiatric treatment, who need medication, how much essential drugs we have to provide. Yes, they need that. But when we talk in our daily language, when we, especially in the lived-in experiences, caregivers and care. So we use family in an inclusive sense. And another thing that is important is the difference of working with families and working on family care model. Now, I'm highlighting family care model for a simple reason. All of us are familiar with institutional care, community care, but we don't talk about family care. Of course, there is also street care for the homeless people who have, we all obvious, I don't have to elaborate about it. Institutional care, community care, all this is familiar, street care is familiar. Why is family care not familiar? Because family is used as part of community. It is embedded in the community. That is the conventional way. Maybe our intellectual legacies from the West, from where we had most of our psychiatry and discipline of psychiatry for Indian treatment and other practices. This intellectual legacies and influences, maybe that's one of the reasons why we use community care and take it for granted that family is a part of community. So it's taken as a cached reality, a hidden reality. This is not true. Because if you actually see the community, as per Government of India statistics, if I remember it correctly, 60 to 70% of persons with mental illness, this is way back in 2002, for 58 National Sample Survey Study or something. I may be wrong. So nearly 70% of persons with mental illness live in families. Now, how many of them reach community facilities? Whether they are rich, poor, middle class, I'm not bringing in those. Out of 10 people who need treatment, only 2 get treatment. And everybody is talking. I am not an expert, mental health expert who is indulged in doing research studies and findings. But as per the survey of demand survey, our treatment gap is 80 to 90%, if not slightly more. I am not surprised, because if out of 100, only 10% are getting treated. And why is only 10% getting treated? Because only 10% are coming out, whether as families or individuals, seeking treatment. And why do the 80 to 90% don't get treatment? Because they don't seek treatment. Now there are various blame games on families. Families don't understand denial. They live in denial. They live in guilt. They don't want to, they throw out their family members when they go. All this blame game starts. But when I was going through it, when I started Amend in 92, the more and more I saw, I realized relapse happens when there is no support system. When we started Amend in Bangalore, we didn't have any ambulance which would take care, which was there to help a family shift the person in dignity, like any other. I'm not talking about dignity, like a patient should be shifted. How do you shift a patient? You don't tie their hands and legs. You shift a patient with care in an ambulance. So why can't a person with mental illness be shifted like that in an ambulance? Why tie their hands and legs? And this was a matter of pride to some international conferences where they will say, villagers even tie the hands and legs and bring the patients in bullet cart. I heard this first in one of the international conferences and I cried. Believe it or not, I cried. I thought of my mother and cried. How would it be for a family to tie? Do you think a family loves tying their hands and legs of their bodies and drag them to this thing? This, even today, I want to say, in most of the states in India, there is no ambulance service provided, and that is advocacy. That is the essence of family care model. That is how I could get that section in the Mental Health Care Act where emergency is a right of the patient. Because I've suffered patients suffering, and families spend a fortune to get the ambulance. It's not a joke. They spend about a couple of 10,000, 20,000, and then it's not the money alone. Why do we treat the person like that? So this is the family care model. It's a total paradigm shift from institutional care, community care, we come to family care. And family care is an independent variable. To me, it appears such family-centric approaches is very important to reach mental health for all. By that, what I mean is, it's not exactly 100% all the families, like for instance in India, about 500 to 600 million families may be affected families, because 200 to 300 million patients are there, maybe more according to demand survey. I'm not saying all 600 families doorstep delivery or whatever is required you have to reach. That's not what I'm trying to say. We have various other, in our Face Me model of family care, there are other aspects to it, with various dimensions of programs. And if the moderator, Dr. Rahul, has to tell me whether I can continue or whether I can share this later. If this is all.
So maybe we can pause at this point of time.
Yes.
And I'll just try to summarize things and then maybe give each one of you 2 to 3 minutes to emphasize on certain aspects of what you have focused on. So is that okay with you?
Of course, Rahul.
Okay, so so first of all, thank you so much for passionately bringing out some of those things, because again, what happens is many a times with scientific experts, it so happens that I mean, none of you are scientific experts, and that's the reason why we have invited you. I mean, you are experts in your own way, but not like a very dull scientists who keep on throwing figures without really having their emotions in. So thank you so much for bringing out that very forcefully. At certain points, it was very, very disturbing to even kind of imagine some of those situations, because no person in this world would love to kind of do or kind of behave in a certain way, which generally what other experts call as expressed emotions or violence and things like that. I mean, no one does it deliberately. So thank you for bringing that out. And again, most importantly, you focused on the entire paradigm shift on not seeing families as objects, some kind of a third party where you kind of work with them or something on those lines, but rather, as you very rightly said, you work on sort of family care. I mean, I'm still not able to pick the subtleties of that, because maybe I don't have that kind of lived experience. But anyway, I'll request you to speak about that later. Now, let me pose one question for each one of the panelists, and I'll start with Mona. What I'll do is I'll very quickly summarize and pose that question for all three of them. In the meantime, I would request participants to start putting in their comments or questions. We have two already. There is one question about what are the barriers for raising voices of people to make mental health priority. And then there's another comment. So please share in your thoughts, or if you wish to kind of know more about a particular aspect from any of the three panelists, please do write that in the chat box. Now, coming to Mona, Mona, what I felt listening to all three presentations was that the field has been so dominated by psychiatrists and psychologists and, let us say, pharma industry, making it a very market centric. So pill is at the center of our entire discourse. Market is at the center of entire discourse, and it is all about dispensing pills in different models. You can call it community model, this model, that model, but ultimately it is about how best you can provide pills to people. And then no one is actually talking about self-care, because there's nothing to kind of gain. I mean, if you sort of empower person to take care of oneself as you are doing, so your self-care modules and your modules on sort of a psychological first aid translating into something which addresses the aspect of self. So bringing in the self as an agent, as a change agent is what I picked up from your presentation. I would like you to very specifically talk about that particular aspect of self-care when I kind of hand it over to you. Anilji also talked about, and Anilji is very passionate about this aspect of World Health Organization creating that pyramid where half of the area of that pyramid is about self-care and non-formal community care. And many a times we discuss about this aspect, that how we actually do it, because WHO has not provided any guidance. No one has actually kind of, I mean, there is very little guidance on those lines. So he, in his presentation, talked a lot about peer support groups and peers or social support, a group of people coming together. So Anilji, when you respond, again, specifically emphasize on certain aspects of that peer support or self-help group. And the third aspect is, of course, related to the families, because it is something which Nirmala ji is very passionately focusing on. And Nirmala ji, whatever you had to kind of talk about the specific aspects of home-centered care, home-assisted care, family-assisted care, I would request you to speak on that. But I would request all of you to kind of not take more than 2 to 3 minutes, because this will take 10 minutes, and then we will have only around 10 to 15 minutes for the specific discussion. So first, Mona, we would like to hear more about the self-care aspect, the self as a change agent, the person herself or himself, then self-help group from Anilji, and finally the family-centered care or the family home-assisted care from Nirmala ji. So over to you, Mona.
Thank you, Rahul. As I answer this question, I would like to talk about the model that I use with whatever work, wherever I work. So that model is based on 4 continuum. And through my experience as well as experts I worked in the field, I have developed this thought that, people have need. There are 4 basic needs. And I'm working with people, in distress or, in need for mental health care. Or generally, people have 4 needs. One is that need to belong, need to be a part of the group, need to be a part of something, some group or be it a family or a community. Second is dignity, very important, we all want dignity. Third is to be in control of my life or what is happening around me. Even, to go when I'm working in disaster settings, to be, and I talk about control, it can also be, what I'm going to eat in the morning. I should have a choice what I'm going to eat, what kind of bedsheet I want on my bed, what color I want my room to be painted. So basically having a choice, having a control. And fourth is, purpose, having having purpose. And purpose does not only come with, one is of course work, the work that I do. Work provides, I remember one of the psychiatrists I worked with said, kaam aapki shobha hai. So work provides, but lots of people actually may not be employed. So beyond work, what are the other aspects that add meaning or purpose to your life? So I always keep these 4 or 5, goals in my mind when I start working with people. So I realized that, of course, if I were given only one intervention that I can develop or one program that I can develop that helps you to, fulfill all these 4 goals or purposes, then it would be self-care. That, when I can take care of myself, I feel more in control. I belong. I feel I belong. I'm a part of, some. I feel dignity. Obviously, I have a choice. I feel safe. I know because I know I can safeguard myself. I can trust people. So this is what got me to, if with the limited resources that we work with, we are a non-profit organization. We only work with people with direct who have direct. With volunteers. So that is, I think, why we made self-care as a core program or whatever work we do, whatever groups we work with. Be it people, we are working with senior citizens group who were feeling lonely during pandemic, self-care. So we realized, self-care helped us to, is something that we have kept common across all our programs.
Thank you, Mona. Thank you for those for excellent dimensions. And I think if we are able to sort of formalize it, it will be great. Over to you, Anilji. And again, as I said, it will be good if you could focus more on this aspect of peer support and informal community level care, which I think many a times we have been very, very passionate about responding to. So over to you.
Yeah, thank you, Rahul. You are rightly mentioned that self-care is an important aspect, and WHO also has highlighted it. And our basic philosophy is that people attend weekly meetings, and within the meetings they learn. And for example, writing diary, I think this is a very important method of taking one's own care. And they learn from each other. They note down the points, what help others. And in the rest of the week, they try to follow that. And so this is this happens for spontaneously. And there is no set pattern for that. But now, after establishing and organizing our groups comfortably, we have realized that self-care, not only for persons with illness or caregivers, but for everyone, it can be an important initiative. And with this in mind, we are collaborating with one of the pioneers in this field, and that is no one but Dr. Srinivas Murthy. And I suppose that he's present here. And because he has developed some models for not only for disaster survivors, but also for patients and caregivers. So we think that such kind of models for patients, caregivers, and for everyone. It can be an important way because people will accept these kind of models. All people, not necessarily patients and caregivers, but any layperson. Now, because of the stress, strain of this modern life, people are facing. So people will find it convenient to accept a self-care model. And while pursuing that, we think that automatically stigma around mental illness also will be reduced, and people will see mental health not as a deviancy model, but as a normalcy model, and something which has positive orientation or well-being orientation. So as a part of our activities, we are going to take forward this particular issue in the times to come. So this is our this is our idea.
Thank you, Anil ji.
Yes.
Now let's move on to Nirmala ji.
Just 1 minute. Have I missed any question?
No. I think this is good enough.
Okay.
Thank you so much. Nirmala ji, over to you.
Yeah. Now, there is nothing as self in the Face Me model because we work at the systems level. Of course, that doesn't mean we don't connect with family, etc. We have a very, very vibrant, active WhatsApp groups. And this through WhatsApp groups, a lot of learning, sharing, as well as personal contacts, one-on-one also goes on. So we have a South Indian group and a North Indian group across India because we are a pan-Indian organization. We are not restricted to any one state. It has its own benefits. It has its own drawbacks because language is one big drawback because across India, you know what it is. Bilingual, 3 languages, all this comes up. Be that as it may, I'll just focus before closing on the flagship programs that we have, and I'm very proud of it. And that will highlight the difference we have made. That is assisted home care. Now, assisted home care does not mean going home and taking the hands of family members and making them aware that this is an illness. No. We change the role of families from objects to subjects. We aim at making families mental health advocates. And there is a very strong misconception among quite a few professionals that family members cannot be policymakers or they can't be they cannot provide legal inputs or inputs for lawmaking and things like that. It's a misconception. Families' lived-in experience is a very powerful input into policy making. It's not necessary we should use the jargon. I try my best not to use the jargon. Though as an academician, I can use the jargon very well from my own management jargon. I try my best not to do it because I don't feel like doing it. I don't think I'll do justice if I do use the jargon. I want to be a mother. That's my role. I want to be just use this and with my passion that springs out as a mother. I'm proud of it. And now you ask me as a self-care, I'm on a platform where there is no self, Dr. Rahul. It's a platform where all of us, most family members have reached. Today, they are able to provide me with instant information on, yesterday I asked somebody employment, this thing for Karnataka, we are want to work on what are the directive for mental illness. Somebody immediately with Google, they could do it. Somebody else immediately could help me with the translation. So today, self-help group that was started by me in 92, if I do it today, I may not succeed. The needs are very different. I hope the mental health professionals, many of them were very sincere and very brilliant community advocates and experts, should understand this. The family is equally well informed. The family is capable. Be that as it may, the flagship programs coming back, assisted home care, it's first of its kind, where Karnataka government is likely to launch it. Likely, they've accepted the Face Me model. It is a public-private partnership model. I don't have any documentation. It's just freewheeling discussion. I'm told I should meet a documentation, but this is one of my strengths that I don't have a documentation because every time I talk, I renew my own ideas and I innovate. I keep on innovating and changing. And I move forward. I keep on correcting myself also. This is very important. So, Asset Home Care is the doorstep delivery where family needs are addressed day-to-day basis, not just an emergency, not just a crisis. Day-to-day basis, psychosocial education, what Mona does and what Anil is doing about self-period, all these are integral part of this holistic approach strategy, that is assisted home care. I cannot go into more details. It contains more medical, non-medical, 3 verticals, that is treatment vertical, rehab and recovery, including family therapy, all those things. Experts like you all advocate, everything is there. And it takes care of early intervention and follow-up also. The other thing, important thing is one of the important things we do is advocacy. That is our forte, as I said, with the central government and state government. Long-term care, who after me is a big question. To that extent, to a small extent, we have corrected with central government of India, a small minor anomaly that was there in the definition of supported accommodation. Now, I don't want to go into details. Anybody in this group who is interested in any legal clarifications based on our family face me dialogues with the government, I'm ready to talk to them on that. It will take a lot of time. Supported accommodation anomaly has been removed. Supported accommodation is one's own residence which can be certified. And it's not necessary for the aged parents or the family members to move out. They can continue to stay. That is one big the change we brought into the central rules of the mental. And most importantly, another thing is we have advocacy workshops, legal literacy workshops for families, and we don't, as families, not just for PMIs or caregivers. It is for families. So we used stories, like Anil uses stories and narratives. So linking narrative to a section in the legislation. That is how we did our legal literacy sessions for families. So it was a beautiful experience. Each family came out with a narrative, and it was very clear to the families that there is a law out there today. There are rights for the loved ones. By trying to enforce their rights, they will benefit. These rights are not just human rights that we talk about. These rights, treatment rights, rehab rights, recovery rights, it's all pervasive. Long-term care rights, family therapy rights, patient, so all pervasive, including emergency. So this is very important. So our advocacy goes on within the rights framework. So we have workshops like that. And before I conclude, I want to also say we are proud to also introduce the eSati app. We have proposed, one of our members, we have a very smart young generation of family members who are techies in leading companies. And there is government of Karnataka is using for mental illness management an application called eManas. It's a technology. It's an app which is given to make the doctors have a record of all the patients who visit the clinic. But as I told you earlier, out of 10, 2 visit the clinic, means I mean the DMHP centers are there. 2 visit and others 8 don't. So what do the families do to access this? In section 18.1 of the legislation, right to mental health care is guaranteed. But there is no way a person who doesn't want to go to OPD clinic can access it. And this eSati app helps, empowers the families. This is a tool. With that positive word of empowering families, I would like to thank you, Rahul. I enjoyed this very much. Thank you so much. Sorry if I have taken a little more time.
No problem.
That shows the miles I have to walk ahead of me.
That simply shows the passion, and that simply kind of inspires people in my and other generations to kind of be passionate and be involved in the kind of work we are doing. It's not just about some academic endeavors, but it is more about how we touch people's lives, including ours. So thank you so much for that. We do have a couple of comments, but I'm also mindful of the time we have. We have now around 9 minutes or so from now. And we have a privilege of having Professor Srinivas Murthy with us, and he wants to make a few comments. So I would now request Murthy sir to kind of say a few words. And if you could, sir, if you could take around 5 to 6 minutes, then we will have around 2 to 3 minutes to wrap up. Over to you, sir.
Thank you very much. I will do it much shorter than that, Rahul. It's a pleasure. Congratulations to all of you, without mentioning names because of time. We are in a very, very exciting, changing time in mental health. Why do I say that? All of you would have seen that the ex-director of NIMH wrote a book called From Mental Illness to Mental Health. You know, the director of the NIMH with billions of dollars writing about it. Similarly, we had the new World Health Report. Tomorrow, the World Lancet Commission on Stigma is coming out. You know, and one thing about the World Health Report, which I had the privilege in 2001, and the 2022, if you see the difference, in the 2001, it was all systems and services. In the 2022, 50% of the boxes are lived-in experiences of people and families. You know, similarly, the Paro Declaration of CRO, which came out about 3 weeks back, talks specifically the individuals with illness experience and families will be part of the solution. Now, I want to go back a little bit back very quickly. Say India has been a pioneer in this area. Why do I say that? As early as 1950, Vidyasagar in Amritsar, CMC Vellore, where I studied, talked about the family in 1950, when the rest of the world was thinking of the family as toxic. You know, you will be surprised that even in 1972, when I started my psychiatry, we are talking about schizophrenic mother, marital skew, all as though the family is the problem. From there, we have come a long way. Historically, the first meeting of the self-help group occurred in 1981 in Bangalore. Dr. Sell, the regional advisor, had a 4-day meeting, and luckily I have still the notes of that particular meeting with me. And so we have a very rich this one. So what we need to do, you will say that, look, Dr. Murthy, if it's all so good, why have we not made enough of progress? I think we have not made progress for 2 reasons. Number one, we have talked about patients and services rather than people. We have not made mental health a people's movement rather than a patient movement. Even the New York Times article last week, Deborah says, services will never solve the problem. We must take the whole thing to the people. What does it mean, taking things to the people? That means we have to make everyone think of mental health as being important to them. Once you do that, if I think of, for example, I use this example, what we are doing in mental health is like saying beauty parlors for ugly people. Sorry for using this example. See, beauty parlor is for everyone. You use a lab, you use a powder, you use an oil, and then when you want to go for a wedding, you go to the beauty parlor. While mental health, we say only when you are ill, you come. So is there a technology, documentation, enough information? The evidence for promoting mental health by individual action, what Anil has called it as self-care, is enormous. We have written about it, and I'll be happy to send it to you. And lastly, I want to say, last 2 years, we have been working with caregivers of developmental disabilities. And my team in Bangalore, the Association for Mentally Challenged, has developed a 1-day program from 10 o'clock to 4 o'clock on 10 modules, 5 to strengthen your mental health, exercise, sleep, relaxation, connectedness, nutrition. 5 things you can do when you are upset: share your feelings, journaling, do pleasurable things, think differently, spirituality. Each of them not as bodhane, but as sadhane. We have given why you should do that, how you can do that, what benefit you will get it. And if you write to me, I have put my email into that. We are in the final phase of making it a very pictorial, very nice book. So the point which I'm making is the point which Anil made about narratives, the point Nirmala made about families. We must think of our strength of India, families, Sambandha, Anubandha, Bandhavya. These are not burden terms. These are beautiful terms that are there. Lastly, we had an opportunity, my team to comment upon the Schizophrenia Awareness Association. They brought out a book called Caregiver Stories, 22 stories. If you see the copy, we have a 20-page summary on 7 areas and a recommendation of 3 pages. What should be done at the level of the government, state, the families, NGOs, professionals. I will be happy to send you a copy of that to comment about. So the point which I want to make is mental health is a journey, not a destination. I'm not holding on. We must keep pushing the boundaries, bring people more and more into the things, and more we make mental health a people's movement. The patients will get better automatically. The same way as I start using a powder or a lip or a oil, I'll think of the beauty parlor when I want to go for a party. We must make that change. And it is time. We can do that with that information technology, with the mobile technology. We can reach all these messages to the people. Thank you very much. I hope I didn't take too much time. And as I said, my email is there. Write to me, or when you come to Bangalore, meet me, or anything you need. I do only voluntary work just for your information. And I'm privileged to have this opportunity to be with you all. Thank you very much.
Thank you. Thank you, Professor Murthy. Again, I would request Akanksha or someone in the team to simply copy paste email IDs and phone numbers which have been in the chat, because what happens is as soon as we end the meeting and we still have 3 to 4 minutes to end the meeting, it all disappears. I would request participants as well to simply go back and copy paste some of those links, because Mona has given an email ID, Nirmala ji has given an email ID, Professor Murthy has given his email ID, Swati has given her email ID. So we still have 3 minutes before we conclude, and I would definitely not conclude the meeting without we have some of these contacts in the chat box in next 2 to 3 minutes. Because I have experienced this multiple number of times that we kind of reach a high by the end of the panel discussion, and then as soon as the meeting ends, then everything is like I don't know where this chat gets saved. Maybe somewhere in someone's computer, but it's very difficult to access. So please make note of all those contact details. A few concluding remarks, a few sort of summary. I'm extremely sorry we are not able to kind of now take up any specific questions. Some of you had very specific questions. There is some of the questions on Mental Health Care Act. Swati has kind of mentioned that she will have another session specifically devoted to Mental Health Care Act, how we do reach out to people, how we involve caregivers, families, people with mental illness in their advocacy efforts. So don't worry about that particular aspect. And then there were certain other, again, most of the questions were about Mental Health Care Act. There was one comment which was sent to me directly, and I would just like to share that with the entire group, that it's expressed, the participant expressed that many a times we, the caregiver and even the person with mental illness, they need someone else to spend some time with them so that the caregiver gets a breather. And I also have that experience. I'm fortunate enough not to be a caregiver for anyone, but when I was a caregiver, again a secondary caregiver, not a primary one, I really appreciated the fact that someone came to me and asked me instead of the person who was suffering about how are you, Rahul? It was something like it was such a relief, because what happens if someone is suffering? All questions are geared towards that person. How is X? But no one asks about caregivers. And again, Nirmala ji, I won't kind of contest the fact that families. It's a synthetic union. It's a unity of the entire group of people who live in a same house. But still, there are individual spaces and individual needs, and we need to kind of understand them. On a positive note, I would like to say that many a times we feel that nothing is changing. It's all the same. We are only talking for so many years. But I think Professor Murthy has given us a very good perspective on that. In 2001, it was all about services and systems. In 2022, it is about lived experiences. I think this is a very important take-home point. 2 decades is a long amount of time, not so long for the human history, but in 2 decades, in just 2 decades, if the narrative can shift from systems and services and pills and therapies to what I feel or what I have gone through as an experience of mental illness, I think a lot has changed. So we need to be very positive on that count. And I'd also like to say that as much as self is important, as much as support groups are important, as much as families are important, pills are also important. Pills do make life better. I mean, they reduce symptoms. Therapies are important. So in India, we are very used to respecting diversity, and we accommodate all the diverse views because diversity enriches and it is helpful. So let's not go back home thinking that this aspect is important and that is not. I think all aspects are important. What was happening till now was that the focus on the person's needs, the focus on family's needs was neglected. It is now coming into forefront. I think I would take this opportunity to. We are 2 minutes over time, so maybe I'll just request Swati if she has anything to say. But on my behalf, I would like to thank Mona, Nirmala ji, Anil ji, and Professor Srinivas Murthy for joining in and making all these very brilliant comments. It was really nice to kind of have all of you here on a Sunday evening. When most of the times we have other things to do, but it's good to see you all here. And thank you so much all the participants for wonderful interaction. We couldn't do justice to some of your comments because there was so much to be said and discussed and shared. But we thank you for your active participation, and I would like now to hand over to Swati for any final concluding remarks.
Wow. Thank you, Rahul, so much. Lot to digest, lot to think about. And thank you for being a fantastic moderator.
Thank you.
Nirmala ji, Mona ji, Anil ji, thank you so much for connecting with us, accepting our request to be a part of this panel, because you all bring these views. And and thank you so much, Dr. Murthy. It's such an honor that you are here. And it's really, we are extremely grateful that you are here with us, and we definitely will connect later on. Rahul, you brought a very important aspect that not one approach is more important than others. The way we had conceived this panel discussion or the topic was mental health has layers in it. So, and we wanted to bring out all the aspects. When I run my CBT programs, when I teach CBT, or when I'm training somebody, or when I'm providing therapy, for example, I tell everybody we are here not to treat the patient. We are here to make lives better. So when we are a therapist and we are providing therapy for a client, we are not just curing the client, or we are not just helping the client, but we are helping the family. We are helping 10 other people. We are building capabilities in that client. So we have to always look at everything like in a more holistic way. And that's why we are saying that interventions at different levels are a part of mental health and mental wellness. So moving from the illness part towards the wellness part. The illness may be with a person, but when it comes to wellness, all of us can contribute. It's the family, it's the siblings, it's the community, it's everybody. And going to the national level, state level policies. So how are the policies helping? How are the Mental Health Act helping? How are laws helping? How is our community helping? How are our families helping? And how are we helping ourselves? Right? So when we look at this holistically, that translates into mental wellness, whereas it can help cure that illness. So with that in mind, thank you so much for all these wonderful perspectives that all of you brought. It was an honor for us that you all accepted this and we have been able to bring this to the wider community. I want to specifically thank and especially thank my team, Akansha, Meghna, if you could all switch on your videos, and all the participants here, switch on your videos. We'll take a couple of screenshots. I have learned this along the way that we need some screenshots. And thank you, Aditi. I don't know if Aditi is here, but my entire team at Swasti Vishwa Institute who have been working with me, and we've been working as a team to bring this entire panel discussion together. So thank you so much for spending your time with us. Thank you all the participants. We are saving this chat, so please get in touch with us for any of your questions, and even otherwise we'll bring some resources to you. Sign up for our social media handles, our Facebook page, our LinkedIn page, our Instagram page, our website, and be in touch so that we can bring more and more such programs for you. These are public education programs that we do, and we are very honored to do that. So with that, I will just request you all to just switch on your videos for a minute if it's comfortable with you, and we'll take a couple of screenshots and we'll call it a day. So thank you, Rahul.
And I assume the record, I mean, it's a live streaming, the recording will be also available. So if you would like to revisit this particular presentation, you can probably do an internet search and you will reach the page. But then I think there's a better way to do that as well. So
absolutely. Rahul, this is why you're a brilliant moderator, because you don't forget these things. Akansha or Meghna, put in the chat the YouTube link where this is going live so that folks can access this and share this, on the social media. So Rahul, thank you. A very special thank you to you for agreeing to be here. Thank you very much. Akansha, let us know when you're done.
Thank you, Swati madam.
Thank you,
Rahul,
Anil.
Akansha, Meghana, Aditi, everyone from Swasti Stream. And thank you very much. Bye.
Thank you so much.
Thank you
Bye-bye.
so much.
Enjoy the rest of your Sunday, everybody, and we'll see you again. Bye.
And let's all greet each other a great Mental Health Day.
Yes.
Hope we can have some proud achievements, whatever it could, by when we track it 1 year down the line. Let's see where we have gone ahead.
Great.
With all the inspirations given in this forum, I think we can all move forward together. Great wishes. Happiness. Thank you.
Thank you, ma'am. Nice meeting you,
Thank you
ma'am.
so much. Thank you, ma'am.